First, when a patient comes in, we offer them a free consultation, which consists of x-rays, the CBCT scan, which is a three-dimensional x-ray, and an examination. And what we're trying to determine is if you're a good candidate for the process. And once we determine that you are, we will do a digital scan, and we will have you come back and we'll take impressions, and we will make you a temporary, which we call a healing appliance. Because once we place in implants, you've probably seen a lot of commercials where you say, teeth in a day. That's not absolutely true, but you will have a temporary where you have to have a diet that consists of soft food, because once the implants are placed, they have to osseointegrate with your bone. And once that happens, that can take anywhere from 3 to 6 months. And once that happens, you come back, we take an impression and we make your final appliance. And then once you get the final appliance, then you go home with it and we go over how to clean it, how to take care of it. But we do want to see you at least twice a year so we can maintain and just make sure everything is working properly and your implants are in good health.